here's another sneak peek into my weekly Zooms. Look forward for you to get some value out of this. So let me give you guys some background. He is not old enough to be on Medicare, so that means his health insurance has to pay for his medications. This particular person has a heart problem, and his heart medication was very expensive. So I want to go through and teach you guys, when it comes to any medication, how you guys can work with your doctor to put you on something that is not only effective, but also affordable. We're not talking about getting the cheapest thing for you. We're talking about something that actually works. But I'm here to go through this discussion so you guys understand how big pharma works and the doctors who prescribe these medications. And this is not going to be just about a heart medication drug. This is going to be about any drug that you guys take. Generic versus brand name. What's the first thing you think of when you have a generic drug when it comes to cost?
Cheaper.
Now, what I want to make sure we're clear about, just because a drug is cheaper doesn't mean it's not as effective. So I want to walk through when it comes to the client that we have who, again, he's not Medicare eligible. So he's under the age of 65. So that means his insurance, who is dictated by his employer. His employer decides what the insurance company is going to cover or not cover based on how much the employer is willing to pay for that employee's insurance. So this person who has to take a drug for his heart, the drug is called Entresto. Now, this is not to be a talk about Entresto. This is just to use Entresto as an example of how this works. Now, obviously, you guys know if you're taking a drug for your heart, the heart is a pretty damn important organ, isn't it? Our goal in this course, of course, is to reverse the problems that created the need for this drug in the first place. That's going to take some time. So while he's working through this, he's going to stay on this medication. But here's the situation about Entresto. It is a 2 times a day dosage, and a 60-tablet bottle is a 1-month supply. Just to keep things simple here, I wanted to pick somewhere that was in the top 3 of the price points, being the lowest cost. So this drug is $723.65 a month. This is the price without insurance, because we're going to put this portion onto the internet for a public service announcement. So if anyone's watching this video on YouTube later on, we're doing this May 2024. And this is when Entresto is a brand without a generic equivalent. They have the patent on this drug, so you cannot get a generic of this heart medication. Novartis is the company that makes it, and they had to test it against other things so that they could tout that their drug is worth the $723 a month to take it. So what did they do? They had to pit it against something else. So Entresto has 8 different drugs that essentially do the same thing. They decided to choose one of them to do the testing against, enalapril. It's also known as Vasotec. It's also known as Epinephrine. It's a drug that when I was in private practice, I heard a lot of my patients were on it. Vasotec was a popular drug. So there's a lot of history on enalapril. So maybe that's why they chose it too. Novartis, they did the drug test for just a little over 2 years. So they pitted Entresto against enalapril to see which one was better. Well, obviously the heart is an important organ. So if you don't do well with your heart, you could die, right? So they used death as the marker of whether this drug worked or not. Let's see how many people die, or actually we should put it the positive way. Let's see how many less people die using our drug compared to enalapril. Enalapril, which has been around for a long time. 17% of people died who took Entresto. When it came to enalapril, 19.8% people died. We can attest to here with the data that we're seeing is that less people died taking Entresto. But you guys know I'm a numbers person, so let's do the actual math. That's a 2.8% improvement. How many of you guys would pay $723 a month for a 2.8 improvement if enalapril is $19.63. You guys are thinking when it comes to this, okay, if I'm going to get a 2.8% improvement in how my heart will keep me alive, I don't know if you want to look at it as being worth it or not. That's a judgment call for yourself. But here's what I want to say. If 2.8% people did get improvement, that means 92.7% of patients had no improvement with this drug, right? Because that's the other side of the coin, right? So 97% of people didn't see a darn improvement with this drug, but are you willing to pay the difference? So let's go over what we have here. 97.2% say no difference in death rate. This is the math. $704 a month more for taking that drug. Or you can look at it this way. Take enalapril or ask your doctor, would it be possible for me to be on a generic form of the drug? And obviously he or she is going to say, no, there is no generic form of Entresto. This is where you say to the doctor, well, doctor, are there other drugs that do the similar thing that you can put me on? And guess what his answer should be? Of course there are. You're going to save over $8,000 a year when you take enalapril. And the average time a person is going to take this drug is at least 5 years, okay? So I know patients would be on drugs for 10 to 20 years, but I'm just going to use the 5-year marker, which is the average time. That's $42,000 difference in these two drugs. There is no reason why your doctor would say, no, but this is the only drug you can take. But here's what I will say. I stand up for doctors in saying they don't know what they don't know. So you may have to help them to know something. And that is that Novartis, when they did this study, they stopped, I think it was 28 months into the study, because they felt that there was so much benefit from this drug that they should get it out to market really quick. That's what I read over and over and over again in the studies. What I forgot to mention here was that the drug companies have such a low bar to reach when it comes to what they consider a fantastic end result is, as you can see in the 2.8% improvement that caused them to stop the testing. And by the way, if the doctor that you're talking to doesn't believe what I'm saying, all you have to have is Novartis, the company, produce the paperwork on the study of this drug. This is not something that's new to the drug market. How many of you have had a drug that you've been prescribed and initially you go pick it up at the pharmacy and they say, oh, that'll be $400, and you go, what? Then you talk to the pharmacist and ask, is there a generic form? The pharmacist is not allowed to change your prescription, but they are able to call your doctor to ask the doctor to change it. So that's another way that you guys can come into play here, where you're asking the pharmacist to call your doctor. I will admit, pharmacists are very, very busy, just as doctors are, because there's so many people that are unhealthy. But here's the next thing that they may tell you. Well, you're going to have to call your doctor. So this is what ended up happening with a client of mine. We ended up having to make 3 phone calls, guys. The first phone call that was made, the doctor said, let me give you a coupon for $10 to get more drugs. Because obviously what happens when you go to the doctor, they usually give you a sample, right? That gets you enough time to get to the pharmacist to pick up your big bottle. Well, when it came time to picking up the big bottle and he saw the cost, he nearly had a heart attack himself just seeing the cost. But that's a one-time, guys. He needs to be on this medication for probably a good year or two as he's reversing in this program the reason he needed the medication in the first place. When the Novartis stopped the research on the drug Entresto, they stopped it short of about 28 months. That means they don't know what's going to happen to you if you take it for 5 years, which is the average length of time it will be taken. Whereas the Zestral or the lisinopril or the enalapril, Those drugs have been around for decades. So not only do people pay more for branded drugs, you're kind of playing Russian roulette in a way, because if you're going to be on them for a decade or at least 5 years, who knows what's going to happen to you? To your kidneys, to your liver. You guys know in this course, what you're doing is you're learning how to make your blood vessels more flexible and also get rid of the crud that's inside of them by doing what? Number one, what do we do in this course? We decrease inflammation. Now, we're not going to go into how we do that because that's in the course, but this is how you guys know to put two and two together when it comes to, is this client ever going to get off of Entresto? Yes, he can, as long as he sticks with what he's learning for the future. It's not the doctor's responsibility to make you have an affordable drug choice. The doctor's just doing their job, which is prescribing a medication for a condition that you have. This is why you guys have to be CEO of your own healthcare. You call the doctor and say, I would like to be put on an alternative medication to Entresto. And they do exist. I just showed you, and let's 8 different drug choices. Think of you going into a fight. You're going into a boxing match. Don't you think you would like to have a smaller, less strong person to fight so that you know that you could win? Do you guys think that when they chose enalapril, that maybe, and I'm just throwing this out there, maybe one of the other 7 medications might have even worked better than Entresto? It's a thought, right? It's a possibility. This is why you guys need to learn how Big Pharma makes decisions to create medications and then test them and then tell your cardiologist or your endocrinologist or your general physician. Drug companies tell these doctors, hey, this new drug came out. This is what you should be prescribing to your patients. And in all honesty, the doctor's just thinking he's doing right by you. But you guys now know how the drug companies work. They go and they pit it against another drug that already exists. I would love if somebody from Novartis sees this video to come on with us and have a discussion about their methodology as to why did you choose enalapril? Was enalapril the best drug out of the 8? Or did you choose the worst drug out of the 8 to compare yourself to? And if they pick the least effective one, is it the responsibility of the doctor to go and test out all these other drugs? No, they're busy seeing patients. So it's our responsibility to ask this question. Now, granted, if Novartis answer this question, why didn't they choose lisinopril? Here's what was interesting. This particular client of mine, before he came into the course, he was on lisinopril for a number of years. Isn't that interesting that he was already taking the drug lisinopril, which is this one here called Zestril, Prinavil. This drug lisinopril is like $10 a month for him compared to the 700 and something. If you learned something so far, then click the like button, or better yet, click the subscribe button so you can continue learning more for your benefit. I want to take a diabetic medication and do the same thing I did here so that you guys can see the price differences and for you guys to be able to know that you guys have choices, because this drug of $723.65 is going to stay at that rate until their patent runs out. And I do want you guys to know that the patent supposedly is going to run out in another year. But here's what's interesting. In another year, when it runs out, they're still not allowed to sell it to the general public. You guys know we have a client in the course that worked for Eli Lilly and Pfizer. If he was here, he would probably be able to give us some more insight on that. And maybe what I'll do is I'll reach out to him before we do the discussion on the diabetic drug. And we're going to do the same thing to teach you again how you talk to your doctors on this. I just want to stop for a moment and let you be aware that this is an edited down version of a longer Zoom meeting that I do with my clients. The reason it's edited down is because I am very aware of the censorship that is now going on platforms like YouTube. due to what the medical industry has gone through in the last 5 years. By the way, if there's a doctor that's listening to this, I would like to remind them, when you're in private practice, you have a representative that comes to represent that company, and that's the one that brings the donuts and the Starbucks coffee and takes you out to dinner. The least that they can do for you is for you as a doctor to pick up the phone and say, okay, my patient cannot afford Entresto. What drug did you test this against? Because if they didn't do the research like I did, they won't know that enalapril was the drug that they tested against. You don't have to be a doctor to have common sense to ask the drug rep, okay, so you tested it against enalapril. What was the difference? And if they said, oh, 2.8% benefit, do you need to do more math than to know a 2.8% benefit? Is that really worth my patient going bankrupt trying to buy this medication? When you call the doctor about this, the doctors are busy, so you don't need to talk to the doctor. You just need to leave a message with whoever can get that message to the doctor, because it's something that's pressing that you have to get right away. I mean, come on, you're going to get a free sample, because all doctors have free samples, right? And you get the $10 coupon. So I would definitely take the $10 coupon and fill this medicine prescription. If the company's going to give it to you for $10, they're only going to give you a 30-day supply. But what's going to happen for the rest of it moving forward? Hopefully you go on lisinopril or enalapril. This is another interesting thing that I found out, and that is if a doctor prescribes you the larger tablet, because you guys notice here, there's different colors. This one's purple, blue, and then green, because these are different milligrams. Here's another trick. You can actually have the doctor prescribe you the higher milligram dose and cut it in half. The copay is the same whether they prescribe you the higher dosage or the lower. So if you need 51, you just get them to prescribe you this one and cut it in half. That's why there's pill cutters. And this actually works for this type of drug.
You know,
Yes.
there's a great movie out there that details how the drug distributors work. It's called Pain Hustlers.
Yes, Pain Hustlers, guys. If you watch that, is it on Hulu or Netflix? Or both?
Netflix.
Okay, guys, Pain Hustlers has a shorter version of Dope Sick. It's called a docudrama. That means it gives you the whole story played out in front of you. And Dope Sick is the one that I enjoyed watching, but it is quite long. It's an investment in your time. I think it's about 8 episodes, whereas Pain Hustlers is a quicker version of the same story. For me, coming from the medical industry, when I watched Dope Sick, it was like reliving 20, 30 years ago when I was in private practice, that I remembered all of these things that had happened. And I was, oh, I remember when that happened. I remember that. Michael Keaton did such a great job in really pulling in the actual history of Big Pharma. Now here's where I show you how to use the website, goodrx.com. And just remember, I'm not getting paid by any of these to recommend them. I'm just showing you how to use them. Okay, if I put in Entresto, see where it says pay as little as $10? This is a hook from the company to get you started on this med so that you get into the habit of taking their drug. I have no problem with you taking the drug. If you're going to pay $10, you're going to get hopefully a month's supply. But eventually you're going to have to figure out what to do, because you're not going to want to pay once the drug goes back to the normal price, right? Because they're not going to give it to you for $10 for the rest of your life. Do you notice this word right here? Valsartan. How many of you have heard of this drug?
After I had my heart attack, November 1st, 2020.
There you go. November 1st, 2020, this drug was around. It's a very common high blood pressure medication. And what did they do? They just combined it with sacubitril. They combined that drug and they create a new one and call it Entresto and jack up the price to $725. You have to put in your zip code in order to know what store is going to be the closest to you with the best price. Which, by the way, brings me to Ed. Where are you at on the testing? What's going on?
I had the heart attack in November of 2020. They gave me Valsartan 320 micrograms back then, right? Obviously, you know, my blood pressure back then was 244 over like 190. So lately, on average, lately my blood pressure is anywhere from like 110 over 77 or to like, maybe 118 over, the 70s. It's not like it's like really excited. I'm just like
Oh,
excited. Bottom is I cut my valsartan in half, right? I mean,
interesting. He's on Belsart and he's been able to cut it in half and that he showed up today. Cutting it
I
in half is amazing.
I live in a small town with the college hospital, so I saw the resident cardiologist. And I saw him about 3 months ago, and he goes, "Tell me all your medications." I go, "I stopped taking all my medications," and he almost flipped out of his gourd. He lost his mind on me. He goes, "What do you mean?" I told him I changed my lifestyle. I've lost weight. My blood pressure is from 244 to like down to 110 over whatever. And he goes, "You can't stop taking medications." I go, "Oh yeah, I'm going to stop taking my valsartan within the next couple of months." He goes, "You'll need to be on blood pressure medication for the rest of your life." I go, "Is that what you think?"
Oh my gosh. Okay, wait. We do need to talk about this because, guys, 110 over 77, when Ed was showing me that, I said, "Hey, your blood pressure is actually too low." I said, "We got to cut that medication back." Ed is completely right. In a few weeks to a few months, he's going to get off of valsartan because if he doesn't, his blood pressure is too low and he's going to get symptoms, which, by the way, tell everybody the symptoms that you were having with the blood pressure when it dropped too low.
Oh, when I bent over like to tie my shoes and I stood up, I was like almost passing out. I'm just like, it was just lightheaded and all that.
That's the drug doing that to him because he no longer needed to push that blood pressure down. And this is what his doctor doesn't understand. His doctor's of the mindset, I put a medication on my patient and they stay on it forever. They're like robots. He's not even taking into account and asking Ed, do you have symptoms of dizziness? Do you have symptoms of lightheadedness? No, they're just rote memory. I'm
They
going
don't
to
want to
prescribe.
hear, they don't want to hear that I've lost 50 pounds, that I've done this, I've done that. They just don't want to hear. They're just like, "No, you need to be on medications." I'm like, "No, I don't."
Here's the good thing. You've lost 50 pounds. You've gotten off of half of the valsartan. And it's interesting that you showed up today when valsartan
Yeah,
was on our list.
that's
And
funny.
and you know what's funny is, like, you guys know Ed doesn't show up as often because he's a very busy guy, but when it comes down to it, the way the universe works, that here he shows up talking about having a heart attack in 2020, being put on valsartan. Now you see him with the progression, losing the 50 pounds, getting half of that medication taken away, on his next level of next time. The next milestone is no more valsartan. Amazing. That's a great place to end on. Thank you, Ed, for ending it on a great note. And as you know, I always end it with the ability for you to click on my calendar if you want to talk about what's possible for reversing disease and getting rid of belly fat for you. The link is easy to find below in the subscription box.